This is Inside PHLCouncil, bringing you the latest news from Philadelphia City Council, straight from the source. Inside PHLCouncil is hosted by Joe Grace and Patty Gillette.
Welcome back to Inside PHLCouncil, a podcast brought to you by the communications team for City Council and President Darrell Clark. I'm Joe Grace.
And I'm Patty Gillette.
We have a lot to unpack today. COVID-19 updates, the state of the gun violence problem in Philadelphia, the other public health epidemic in our city, and some updates on what's happening in councils. We're going to dive right in. Patty, what's the latest on the COVID-19 pandemic and how it's impacting Philadelphia?
Sure. The latest city numbers were announced just a couple hours before we started to broadcast today. 465 new cases today. Just over 119,000 cases overall since the start of the pandemic last March. And sadly, 3,229 Philadelphians have died from this virus, again, since the start of the pandemic in March 2020.
Wow.
Yes, exactly. A lot of the attention is obviously now focused on vaccine distribution in Philadelphia, so we can prevent more illnesses and certainly more deaths. The vaccine distribution has had a problem-plagued beginning, to be sure. Very early on, the health department allowed an inexperienced group, Philly Fighting COVID, access to vaccines as a provider, and just about everything that could go wrong did go wrong, as many of our listeners may have read in the local media. Yes, we know this story. But just for those who may have missed it, the group switched its status from nonprofit to for-profit and neglected to let the health department know. There were significant concerns about their privacy policy and whether they might try to sell the personal health information and data of the people who were signing up to get vaccinated. And oh, by the way, the head of the Philly Fighting COVID group, who was a 22-year-old, admitted that he took a small number of doses off-site after a vaccination event and used them to vaccinate his friends. So the city terminated its relationship with the group, and a deputy health commissioner with the city who had been in charge of vaccine distribution resigned as a result of incidents related to the scandal. So
That's a lot.
It was a lot. We know it was a lot. It raised a lot of questions, legitimate questions about whether the city knew what it was doing. And some of those questions have lingered. It's worth noting that, as a result of this scandal, council did pass legislation to help codify the kinds of organizations that could receive the vaccine and for distribution. So that legislation is now in effect.
A good reform.
Absolutely good reform. Fast forward to the present, FEMA is now here at the convention center vaccinating up to 6,000 people a day, but we have the persistent problems of equity of who's getting vaccinated. The percentage of Black and Brown residents getting vaccinated at the convention center and citywide is still significantly below the percentage of them in the population at large. So ongoing concern.
So let me jump in for a minute. That was a great update. So the city and FEMA are doing something this week to try to address these disparities that you're talking about, aren't they? They've opened up the convention center to walk-ins. Tell us about that.
Yes, prior to Wednesday, you needed an appointment to get into the convention center, and largely you'd make that appointment utilizing, an internet connection. You would get an email or somehow, and there were certainly access issues regarding that. So starting Wednesday and extending through early next week, if you live in one of 22 targeted zip codes in Philadelphia, and most of them target areas and neighborhoods where there's a large percentage of residents who are people of color and in areas that have been hard hit by the virus, and you fit into categories 1A or 1B, you can just walk into the convention center, show your ID to show you where you live, and you will get vaccinated. You don't have to register online or make an appointment. Now, as a reminder, categories 1A or 1B are essentially frontline workers, persons 65 and older, or people with certain pre-existing conditions. It's a long list of pre-existing conditions and a long list of the eligibility. So what I would tell people to do is to go to phila.gov/COVID so you can see the details on eligibility for 1A and 1B. And I'll link to that in the show notes. But
Good.
it's key. Yeah, but it's key that, not needing an appointment is key, because that's where we're hearing the bottleneck is the ability to get online and make that appointment and keep refreshing your screen so you can see the appointments and get your data entered. It's really blocking a lot of people out.
So what are we hearing so far? This has only been a couple days, but how's the walk-in effort going so far from what we're hearing?
The early data shows promise. In the first 2 days of the walk-in option, the percentage of people of color getting vaccinated at the convention center has increased noticeably. Dr. Farley gave an update earlier today, and he said the percentage of Black residents vaccinated was up to 22% of the total. Those who identified as Hispanic were up to 21%, and Asian residents were up to 20%. Those numbers are nearly double what it was prior to the walk-in option when we were doing just online appointments.
So that's encouraging. That is definitely encouraging. How about the rest of the city? What do we know?
Mixed. It's mixed. Our larger hospitals and healthcare systems are vaccinating at a rate of about 3-to-1 white vaccine recipients to Black recipients. Some of our pharmacy chains are running at about 2-to-1 white recipients to Black recipients. And one chain, Rite Aid, was a real outlier, again, in the wrong direction. Through the end of February, according to data that we obtained through the Philadelphia Department of Public Health, Rite Aid's numbers were about 20-to-1 white residents to Black vaccine recipients, white vaccine recipients to Black vaccine recipients. That's just incomprehensible when you remember that, in terms of general population, Philadelphia is a majority minority city. Like, most of our residents are people of color.
I mean, that's just unconscionable. Now, I understand that Council President Clark and Councilmember Cindy Bass, who chairs Council's Public Health and Human Services Committee, they sent a letter very recently to the Centers for Disease Control and Prevention, who control vaccine going to these pharmacy chains in Philadelphia, demanding the CDC look into Rite Aid's performance. I guess we'll have to see what comes out of that letter. Patty, just a question. What percentage of Philadelphians have been vaccinated so far, and how are we comparing with other cities?
Well, I'm glad you asked that. Actually, Councilmember Alan Dom brought this up during our stated meeting this week. He disclosed, based on his office's research, again using data available from the Philadelphia Department of Public Health, that Philadelphia has, as of this week, vaccinated 5.7% of its eligible adult population. And that's below other cities. According to their research, Chicago is at 10.3%. Phoenix has reached 21%, and Boston is at 10%, and Atlanta is at 13.4%. So again, if that data is accurate, we have some work to do.
We clearly still have a long way to go, don't we? What else can you tell us? How are council members getting involved to try to impact these numbers?
The council members are trying to get very engaged. They're all, you and I know from inside, our phones are ringing off the hook with council members asking, what can we do? What can we do? We want to know what we can do about vaccines. This week, nearly every district council member made robo-telephone calls to those targeted zip codes, the zip codes that were in their districts, letting people know about the walk-in opportunity at the convention center. And about 170,000 of those robocalls landed and connected with residents. And
That's great.
we can see the results. As I said earlier, the percentage of Black and Brown and Asian vaccine recipients is ticking up at the convention center. So we do think those calls are having an impact. Council members are also showing up at neighborhood vaccine clinic sites that are opening up around the city. We've got 2 more coming up in the coming week, one in the far northeast and one in West Philadelphia. And so with those opening, we'll be up to 10 neighborhood sites where people can go to get vaccines in their neighborhood. They won't have to go all the way downtown to the convention center. And we think that's going to break down some barriers and make it easier for people in the neighborhoods to get vaccinated.
Well, that's a good way to end, at least for now, an update on COVID-19 on a somewhat helpful, hopeful note. Mm-hmm. Let's switch gears a little bit and turn to the other public health epidemic that's hitting our city, where the numbers are not so hopeful, and that's gun violence. Let me quickly go over some top lines. 499 homicides last year, the highest in 25 years. Over 2,200 shootings, one of the highest numbers ever recorded. This year, the numbers are continuing to escalate. We have 106 homicides through March 18th, That's up 33% over last year. Shootings are up to nearly 700. They're 36% higher. And we have 383 shooting victims, and they're up nearly 50%. Patty, these are terrible numbers.
Yeah, they're absolutely terrible numbers. And when you think about like when we're doing the comparisons, you said that we're seeing things up of 33%, 40%. Last year was a terrible year. So we're doing worse than an absolutely incomprehensibly terrible year.
Right.
We are awash in gun violence. And we have to remember, these are not just numbers, they're human beings. It's a 15-year-old shot and killed in Kansasing. A 20-year-old young man shot and killed moments after his release from a city jail in Northeast Philadelphia. That happened Wednesday night. A triple shooting at a playground in West Philadelphia that left another young man dead. I was going over some of this data this morning, and some of this data comes from the Philadelphia Center for Gun Violence Reporting at Community College of Philadelphia, which is a tremendous resource for all of us, including those of us in council and all Philadelphians. And they pointed out that on a single day last week, on March 11th, 2021, 4 Philadelphians under the age of 18, so essentially children, 4 Philadelphians under the age of 18 were shot in a 24-hour period, 2 of them fatally.
I mean, that's just, I hate to just keep saying terrible, but it is terrible. And, you and I know this, let's let our listeners know, we're not alone. Most major cities in the United States have experienced an uptick in gun violence during the pandemic. No one has a definitive answer. If anybody says they do, I don't believe them. No one's got a definitive answer. There is the issues of joblessness and poverty, a sense of despair or hopelessness. There's nowhere to turn for help or for constructive outlets for young people, things to do. So what can the city do? And maybe more specifically, Patty, what is city council doing?
Well, council's been very active on this issue, and that's going to continue. Councilmember Jamie Gauthier, who is our guest on today's podcast, and you'll hear from her in a few minutes, she's been advocating for the mayor to declare a state of emergency similar to what the city has done in response to COVID-19, and to mobilize city resources in the way that the city has done with COVID-19. And as a result, one thing the mayor and Health Commissioner Dr. Farley have begun doing this week was to hold public briefings to talk about the gun violence problem and talk about what the city is specifically doing. We had the first one on Wednesday. They plan to continue them.
That's a start.
It was definitely a start, and we definitely, I know Jamie, Councilwoman Gauthier did talk about watching it, and we've seen some discussion on Twitter with real feedback for the mayor's office and for the health commissioner about how we can make these briefings better. So I do think they're a work in progress, but we're off to a good start. Council approved the Office of the Victim Advocate, and that initiative is being developed and staffed currently. That was Councilmember Kenyatta Johnson's idea. And Council President Clark and his members are working closely with the Father's Day Rally Committee on a series of gun buyback events. And this is an event where you turn in a gun and you receive a $100 gift card for groceries. I want to specify it has to be a working gun. And in January and February, these efforts took 381 firearms off the street. And those were wildly successful, particularly since, as we constantly point out about these gun buybacks, it's not city dollars that are being used. That's private money that's donated. So not a single city dollar is being used to get these guns off the street. The private sector has stepped up to help us solve this problem. Now, taking those 381 firearms off the street, those are 381 firearms that will never be used to harm anyone, either intentionally in a gun crime or in a tragic accident in a home. They are going permanently off the street. The Philadelphia Police Department destroys them after they are collected.
I'm so glad you said the very last thing you said, not the destroyed aspect, but the tragic accidents. Because you and I both know that some people will question whether gun turn-ins or gun buybacks or whatever you want to call them, whether they're effective. They're not, quote unquote, crime guns being taken off the street from the scene of a crime. They're coming in usually out of someone's home. But as you just pointed out, as Councilman Jones pointed out in a previous press conference we did with him, every one of those guns can never wind up causing a terrible tragedy inside a house. And that's priceless. The result of that is priceless, because we know that happens in our city. And those 381 guns, it can never happen again. There will be no tragedy in a home. So I'm really glad you pointed that out. It's clearly not just one thing that's going to solve this epidemic. We have to act on multiple fronts. And I thought it was moving this week in council when our majority leader, Sherelle Parker, spoke about that young man shot to death outside the prison that you referenced. She knew him. He was an aspiring rap musician. He had a name, Rodney Hargrove. She put a human face on this epidemic of too many guns and too much violence in our city. She vowed to change the culture, she said, producing this violence. And we sincerely hope that she can and that the city can. Patty, let's turn to our guest today. Would you like to introduce her?
Absolutely. Councilmember Jamie Gauthier is a first-term council member representing the 3rd Council District, which covers large sections of West Philadelphia, including University City and many of the neighborhoods in that region. She really hit the ground running in council in 2020. She's been very involved in issues surrounding housing and affordable housing, and she will hear her go into greater detail about that in a few minutes. And as we said, she's gravitated towards the issue of gun violence, which impacts her district significantly. And she's consistently said that gun violence is a public health epidemic that we must treat holistically, not just through law enforcement initiatives, but through social initiatives as well. She has a lot of interesting ideas, and we are proud to have her on Inside PHL Council today. So you'll hear from her after the break.
I can't wait to hear the interview. And Patty, thanks as always. And it's always great to have Inside PHL Council back available to our listeners.
Thanks a lot, Joe. And let's get to our interview.
Like what you're hearing? Be sure to subscribe to Inside PHL Council on your favorite podcast app.
We're here with the council member from the 3rd District to talk about some of the key issues that she's been working on since she took office in January 2020. First of all, I'd like to thank Councilmember Gauthier for always being right out the gate whenever we request something of her, particularly during this pandemic, whether it's a PSA or whether it's robocalls or anything we can do to help during this COVID-19 pandemic. Her office is one of the first to respond. So I wanted to acknowledge that, council member.
No problem at all. And thank you to both of you for all you've done to help us communicate with our constituents.
We're really excited to do this with you. I echo what Patty said. And we're really looking forward to having a good discussion with you today on Inside PHL Council. So if you're ready, I'll take the first swing and talk to you a little bit about an issue that you are passionate about and that you've become immersed in a short period of time. And that's the gun violence epidemic facing Philadelphia. So last September, you introduced a resolution which was passed by council, asking the mayor to declare gun violence a citywide emergency and to develop an urgent, unrelenting response to the city of Philadelphia's gun violence epidemic plaguing Black and brown neighborhoods in Philadelphia. Council lady, can you talk a little bit about how this declaration could impact people in the neighborhoods that you represent and other neighborhoods across our city that are hit so hard by gun violence?
Sure. So I've been in council just a little over a year, and as you all referenced, we've had a variety of crises this year, including COVID-19. And so I started in January of 2020, and by mid-March we were shut down. But it was apparent to me pretty early on that not only were the neighborhoods I represent being ravaged by COVID, they were under siege, due to gun violence. And it seems like not a day goes by that there's not a shooting in West and Southwest Philadelphia. And so I began to think that this is every bit as much of a crisis as COVID, with us losing, almost 500 people in 2020, with us being on track to have the most violent year in Philadelphia's history now in 2021. And I think we need to have this as our city's city's top priority right alongside COVID. And so that was sort of the impetus for asking the mayor for the emergency declaration. I think we need to be putting many more resources into violence prevention and intervention. I think that we need to be more effectively using and leveraging the private sector, calling on the business community to help us and our world-class institutions. I want to see every agency in the city of Philadelphia having gun violence as their top priority and resourcing neighborhoods appropriately. And I want our residents to have information. With COVID, we see Dr. Farley or the mayor on our TV and on the internet every day talking about the issue and what we're doing to address it. Gun violence deserves the same level of priority, particularly with the amount of young people that we're losing to this crisis on a day-to-day basis.
We were just chit-chatting before the podcast started about something that you called for. Mm-hmm. And as we record this podcast with you today, I think today was the first step of action by the mayor's office in responding to something that you called for, which is a more public response, a more public updating on the issue of gun violence. And the mayor held a briefing that was accessible to the public today. What did you think about that? Is that the kind of thing that you're looking for?
One, I think it was great that it happened, and I commend the mayor and his team on taking that first step. As I've been going around, to the places where shootings have happened in my district, one thing that felt really unjust to me was that residents had no idea of what the city was doing to combat this problem and felt like they feel like they're alone in this. And I don't think that that's right. And so I wanted the press briefings to be an opportunity for transparency, for needed critical information for our residents, and to provide a level of accountability for every agency that's working on this issue. So as you mentioned, today was the first one, and I think it was great. I appreciated that the mayor and his team are looking at these briefings in a comprehensive sense. So not only was the mayor there, Commissioner Outlaw was there, Erica Atwood was there talking about what we're doing around prevention and violence intervention. Tamara Alexander, our managing director, was there, and that's exactly what we should be doing. We need that. Multiple agencies are working on this issue together, and they should communicate about what it is that they're doing. And I know these are going to be sort of evolving press briefings, so I think we'll get better and better at this as we go. One thing that I would like us to do is to provide more information on where residents can go for help and for resources. So as an example, the police department showed a lot of information on the impetus for shootings. Domestic violence is one cause of shootings. Arguments among people is a common cause of shootings. Okay, well, if we know that those are the causes from a prevention standpoint, what are we doing? And if people are experiencing domestic violence in their homes, where can they go for help? If people are experiencing conflicts that they need help negotiating, where can they go for help? We talked about during the briefing a lot of these kind of beefs and issues arising on social media. If parents see troubling things on their social media, where can they go for help? And I mean beyond police, right? Who can they call to help to steer their young people in the right way? So we need to be looking at these briefings as a way to provide information, yes, but also as a way to provide help to our residents and as a way to help residents help us. And that's how I'm hoping that they will evolve in the coming weeks.
What you just said sounds like, and I know you have interest in this. I already know that you do. It sounds a little bit like the idea that council passed by resolution a week or two ago when the council president had a resolution introduced creating that anti-violence resource center. And I know that's still a work in progress. I know that still there's a lot of planning work being done around it, but I know you have interest in that. And it almost sounds like what you're talking about right now, as you talked about the things that you think citizens need.
Yeah, absolutely. And I think that the sort of the resource hub described in that resolution and the hotline is a great thing. We need to let our residents know where they can go for support, where they can go for help, right? And I liken this again to COVID. As when we're communicating about COVID as a public health crisis, we're telling people what we're doing. We're telling people how they can stay safe. We're telling people how they could get help. We should be thinking about gun violence in much the same way and delivering that same type of information and help through these channels, whether it be the press briefing or whether it be, this hotline and this hub that we're going to set up. Is exactly what's needed at this time.
You just mentioned COVID and the city's response to COVID, which of course has been pretty sweeping. Is there anything in particular, in addition to the public briefings, which I think is really important, is there anything specific that you see the city doing from a COVID-19 response perspective that you think they should be applying into the gun violence epidemic perspective?
I do. I think COVID showed us how our city can mobilize, respond, and use every resource at its disposal to address an emergency or a crisis. We shouldn't be thinking about this differently. So as an example, with COVID, 2 weeks into the shutdown, we saw Parks and Recreation working with the school district to stand up food sites all over the city. That was amazing, and it was needed for our residents. But our city agencies should be working together in much the same way to resource neighborhoods that are really struggling with gun violence right now, right? That same type of rapid emergency response and collaboration is needed in dealing with gun violence. With COVID, we saw the city rally its philanthropic resources. We saw Brian Roberts put $5 million on the table for laptops. We saw a fund set up with the United Way that provided millions of dollars for people who were struggling during the pandemic. Why not reach out to the philanthropic community in the same way? We need jobs for young people right now. We need support for anti-violence programs right now. We need activities in our communities right now that can provide positive opportunities for youth. In short, we need to use every resource at our disposal to save all of these young people we're losing on a daily basis, and we need to be prioritizing this much in the same way that we prioritize our other public health emergency.
So, Councilmember, just one other question from me for now before I turn this over to my colleague, Patty Gillette. You got some action today, and the administration held its first public briefing, hopefully of many, on gun violence. Have you been satisfied thus far with the response from the administration to, your resolution asks for certainly more than that. It's true that the public briefing happened today. That's a step forward. Have you been satisfied overall?
I will say it's been a very frustrating experience in that, I talked to you about kind of going to the sites of these shootings and talking to residents and having them voice despair, having them voice that they don't know what's being done to help them. I feel like there's an injustice in that. There's an injustice in not having your needs met as a community member and in living in a neighborhood where you can't be safe. And particularly, this is an issue that's impacting Black and Brown people. And so it's been very frustrating to not have this dealt with as an emergency. It's been very frustrating, in particular, to see that we're losing so many young Black people, 14-year-olds, 15-year-olds, 16-year-olds, and to not have the type of response that I think our city is capable of. And I don't misunderstand that this is an issue that's happening across across the country. I don't misunderstand that it's a hard issue, but I don't, in my heart of hearts, I don't believe that we have to be helpless or that this is an unsolvable issue. There are evidence-based programs that have worked to reduce gun violence all over this country. And so it's been a little frustrating and also somewhat confusing why we wouldn't have taken the path of declaring a citywide emergency. We've done it with other issues like opioids, for example, and that's what we modeled our resolution around. But that being said, I'm glad that we took this step today, and you know, and I felt a sense of gratefulness in seeing people stand up and talk about this issue in the way that it deserves to be talked about. And I hope that we will join, you know, the public briefings to robust investments in prevention and trauma supports for neighborhoods. That's when I think we're going to really start to see a difference.
Well, I hope that you're right, and your passion is inspiring. And you are welcome. I'm going to turn it over to my colleague, but I want to really underline your passion is inspiring on, as you put it, a tough, hard issue that a lot of us have worked on for many years. So thank you for what you're doing, and keep that passion at a high level, because we're definitely going to need it.
Thank you.
Thank you, Joe. We want to switch gears a little to some questions about affordable housing, but I do want to just make one follow-up point about the gun violence conversation, which I thought was great. One of the things I did in preparation for this interview was I looked at your interview with Inside Story about gun violence in your resolution, and you made a similar point about the private sector. About, you know, Comcast and all of these things that happened during COVID, where these nonprofits and private entities stepped up and invested in solving the problem, and how that is something we really need with gun violence. We've seen Joe and I have seen a little bit of that locally. We've had some in our gun buybacks that we're doing with City Council. We've had those gun buybacks, and people don't know this. $100 for each, you know, working weapon that's turned in. Every single dollar that's been handed out in gift cards has been donated privately. Not a single city dollar has been spent on that. So that's one of the things I want to see is, you know, to your point, I want to see some of these corporations and local entities being able to say, gun violence impacts us too, in the same way that COVID impacted all of us. So we're going to put our money where our mouth is to make this a safer city. So I really wanted to add to that point. But onto some of the non-gun violence issues that you've been working on. In December of 2020, again, towards the end of your first year in office, your office released a report in collaboration with the Reinvestment Fund about the state of affordable housing in the 3rd District. And for those who don't know, your district includes parts of West and Southwest Philadelphia, including Cobbs Creek, Mill Creek, Belmont, University City, Powelton Village, and other neighborhoods. And this was an important study. You called it a first of its kind study, especially for the 3rd District. Can you summarize some of the key takeaways from that study?
Yeah. So what I will say that study affirmed a lot of what I had been hearing about from people in the district. When I campaigned, I did a lot of door knocking. I had a lot of conversations with people throughout the 3rd District. And one of the things that I heard most about was the housing crisis, and how neighborhoods are changing in a way that people feel is out of their grasp, right? I heard people telling me about, you know, how they're seeing their neighbors get displaced. I heard people talk about the rising cost of housing. I heard people talk about how they didn't have the ability to make critical repairs, you know, to their homes, and how scary that was for them because they didn't know if they would be able to stay in their neighborhoods. And as a council member, I have quite a lot of as a district council member in particular, I have a lot of conversations with developers who want to come to this district and build housing. And I'm in this constant negotiation about pushing them to build housing that people can afford. Because most of the time, what they want to bring here is outside of the reach of what people can afford. And I wanted to make sure I was having these conversations from a data-informed perspective, in a way that would provide strength to what I was trying to do in terms of, my negotiations, but also in terms of policy that I was trying to make. And so we were able to, through the council president, to contract with the Reinvestment Fund, and they did a study on the state of affordable housing in the district. And that study affirmed a lot of what, we already know, that we don't have enough affordable housing to meet all of the needs of people here in the district. We learned that about half of the district is cost burdened. That means that they spend at least 30% of their income on their housing costs. A significant portion of those people are severely cost burdened, meaning that they spend up to 50% of their income on their housing costs. We learned that 85% of the people who are cost burdened in the district earn less than $20,000 a year, meaning that they earn less than 25% of the Philadelphia region's area median income. And we learned that it would cost tens of millions of dollars to provide all of the affordable housing that we need in the district. The study also showed us a lot about particular neighborhoods that we need to be keeping an eye on right now in terms of our affordable housing efforts. So the area around 52nd Street, for example, parts of Cedar Park, parts of Belmont and Mantua are areas that are poised to gentrify if we don't step in with policy, with subsidy, with the partnerships that can deliver the housing that people need.
And, in deciding the study, I have a quote from the study. In the summary, it says, the gap between the affordable housing supply and the demand in the third district is extensive, and that it will only grow wider in the wake of COVID-19. And then this district residents are particularly vulnerable to housing instability. Now, obviously, COVID-19 and the length of this pandemic has made that even worse. And now that we're finally starting to see some of the interventions, both locally and nationally, to address this instability in the short term, some of us are starting to look ahead and said, okay, we've addressed this in the short term, but this doesn't solve the long-term problem. From your conversations with your constituents, what are the top solutions that you're seeing that that leaders should be looking at long-term, so we're not just putting a Band-Aid on the situation in terms of a check this month, but what happens next month?
Exactly. So one thing I think we need, and which is something I'm working on with Councilmember Quinones-Sanchez, is mandatory inclusionary zoning. Within gentrifying neighborhoods, I think we have to require that developers are building affordable units in what it is they're constructing. I don't believe that we should be leaving affordability to the whims of developers, right? I think as policymakers, have a responsibility to ensure that neighborhoods advance equitably. Councilmember Quinones-Sanchez, of course, did great legislation several years ago that offered a voluntary inclusionary zoning law, which says that developers will get incentives for density and height if they either include affordability in their buildings or if they contribute to the Housing Trust Fund. That's generated millions of dollars for the Housing Trust Fund and for affordable housing in the city. However, we need to go to the next level, which is requiring the affordable units inside of these developments. So I think that will help a lot in gentrifying neighborhoods, and I'm excited about that. I think that our city has to be more strategic also about how we use city-owned vacant land and property. We actually own a lot of vacant land and property as a city. We should be absolutely prioritizing that for genuinely affordable housing, particularly within neighborhoods that are gentrifying. And so I'm working on a policy that would give support towards community land trusts that would, use that city-owned vacant land for affordable housing in perpetuity. And I think that vacant land and property is one of the most important tools that we have as a city to ensure affordability. I think we have to fight for more subsidy. We need more subsidy to finance the development of affordable housing. We need more subsidy to help renters who are struggling. The rental assistance program that we stood up during the pandemic was amazing and helped so many people. We need to do that on an ongoing basis. And we also need to help longtime homeowners with their homes and to stay in their property. So those are some of the things that I think could work and could help.
And this is my next question, my next to last question, and then maybe we'll have some more extra time to chat, is that, when you took office last year, 2020 feels like 5 years ago, by the way. I'm sure it does for you and all of your staff. It certainly wasn't the first year in office that you anticipated having. I remember all the freshmen for, and like that includes you and Councilmember Brooks, Councilmember Thomas, and Councilmember Gilmore Richardson being so optimistic at the Met, being your faces were just glowing. You were so you're so excited, and then like 2 months later, what's happening? What's going on? We're doing what? So. I guess my curiosity is, I know you guys are still in contact with each other through the pandemic. You're working on legislation. You mentioned some of the legislation, the rental assistance. That's something you guys worked on together. How have the conversations among you as the freshman four changed as your priorities have had to change, and everyone's priorities have had to change in the last year since March?
I think that, we came into office with a strong bond and, offering a lot of support for one another. And I don't think that that's changed throughout this year. I think it's actually grown stronger as we've had to negotiate so many crises. For my part, it seems like we've seen everything kind of hit the third district, right? From the pandemic to gun violence to civil unrest. I've tried to, throughout that, focus on the things that are most meaningful and important to my constituents. And I think that my colleagues, that are a part of the freshman four, I've seen them do that too. And so I feel like all of us kind of were thrown right into the fire, but I've seen us rise to the challenge and also to support each other through that, which has been very nice and important, actually, in such a stressful time.
I mean, now you guys, you probably had more virtual stated meetings than you had in-person stated meetings as a council member, right?
Yeah, we have, and that's been a little bit tough in that I just feel like we lost out on the opportunity to build the relationships that we might have if we could see people in person and go into their office and see their facial expressions and be able to see their body language, right? There's just virtual communication does not equate to, building real relationships in person. And I look forward to getting back to City Hall. But I still think that we've done the best that we could within this environment, and being in this virtual environment has made me appreciate the bonds that I've been able to create with, the freshman four and the rest of my colleagues too.
Go ahead, Joe.
Councilwoman, you sound like, not to put you on the spot, you sound like the council president. He says that the hardest thing for him in the course of this year is he cannot sit in his office and look across the table at another member and hear what they need, and for them to hear a little bit of what he needs. And he cannot do that. And that sounded incredibly similar to what you just said.
Yeah. And he always kind of, he always says that he misses us, but I get the sense that he feels that way too, that he wishes that we were all in person. And I feel so.
He does.
Yeah.
He does.
That is absolutely sincere.
On housing, you have some very large, and I'm not going to single anybody out, you have some very large nonprofit institutions in your district.
Yeah.
Do you see, you can single them out if you choose to, do you see a role for them on these urgent issues of affordability and housing for people in the third district?
Absolutely, I do. I think The third district is a unique place because we have most of the city's meds and eds here within our boundaries, which makes us an economic engine, not even for the city, but for the region, right? And it also makes us a place where people want to come, they want to go to school here, they want to work here, they want to live here. But there are some, so that means that we have a lot of resources here and assets here. But at the same time, we have 35% of people in the district living in poverty pre-pandemic. We have gentrifying neighborhoods where we know Black people are getting displaced, right? And so my push is to make sure that there's equity in what happens here and that every resident who lives here in the third district can benefit from the assets, can benefit from all that we have here. And I think the institutions play a big role in that. Additionally, the institutions in University City, many of them were built on top of Black neighborhoods, right? So for them to form and grow, it wiped out Black wealth. So not only is there sort of a past injustice, there are some current negative impacts that we need to guard against. And I think the institutions have to play a role in that. And so my constant push is for there to be positive impacts in the neighborhoods that offset some of those things that could harm people. So as the institutions are developing, I'm always pushing for community benefits, whether that be more affordable housing, whether that be access to programs and resources for young people and other community members in our neighborhoods. It is a consistent negotiation. And it's also tricky because they're partners, but they're also people that sometimes I have to advocate to and to push.
I think that was a good question, Joe, because this is prior to Councilmember Gauthier's arrival, but there was an exhibit, there's a multimedia exhibit a couple of years ago on redlining that, as you mentioned, Councilwoman Sanchez, she participated in that documentary about it, and so did Councilmember Johnson. And this, as someone who was not born in Philadelphia, that documentary educated me about specifically the third district and how some of the expansion of those institutions did displace Black and Brown communities. And so all of those things, those are conversations we've been having, that we have to keep having, because
those communities were not compensated for that. So, that cannot be forgotten. So it's a past, but it's also a present impact that needs to be dealt with. And sorry, I didn't mean to cut you off.
No. I think it's great. And actually what I'll do is I may drop a link to, I know the documentary is on YouTube now. If people missed it, the one on redlining, I will drop it in the link in the show notes because I think people should watch it. I've shared it with a lot of people because I learned so much about my city, not just the third district, but redlining throughout the city, about the history of my city, my adopted home, by watching that documentary.
Thank you. I want to watch the documentary.
Patty, I'll turn it over to you to close with our guest.
Oh, okay. Thank you so much, Councilmember. We really appreciate your time today and talking about some really important issues to the city of Philadelphia. And come back anytime. We'll chat some more, and hopefully we'll have a little bit. Hopefully we'll be able to do it in person next time and sit across the table from each other the way we used to record the podcast.
Yes.
Thank you. Thank you.
And I appreciate you guys having me, and I've really enjoyed the conversation.
Thank you.
Us too.
Visit our website, phlcouncil.com, where you can subscribe to this show, get contact information for each council office, learn more about our legislation, and find dates for upcoming hearings and meetings. Follow us on social media. We're PHL Council on Twitter, Facebook, and Instagram. If you enjoyed this show, we'd appreciate a rating on iTunes, Google Podcasts, or your favorite podcast app. Inside PHL Council is produced by Philadelphia City Council. This episode is adjourned to the call of the next upload. Thanks for listening.